I am really hot and I am really thirsty and I have no idea where I am.
Get them into that ice bath is more important than throwing them in the back of your ambulance.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
All right, we're talking about hyperthermia today.
Hyperthermia on the EMS show.
That's right. Make sure to like and follow. You can, if you subscribe to our website, you can get CE content for these podcasts, or you can watch them on YouTube for free. But make sure to like, follow, hit the like button, give us a comment. That really helps us out. We appreciate it.
Yeah, becoming a follower. I didn't realize how important that stuff was.
Well, and liking and comment, that puts us into the matrix or whatever. I don't know.
Yeah, let's get this content.
Two old dudes trying to figure out social media. Yeah, we just want to reach people. We want to get the message out there. But, right now, we're in Texas.
We're in a heat dome.
It is the end of June in Texas, which we know is always going to be hot. But the rest of the country is experiencing a heat wave. I was talking to my mom the other day, who lives outside Chicago. And Chicago can get very hot. It's not uncommon to have temps in the high 90s. But for mid-June, to have it be, I think she said it was like 96 the other day. Right. That's pretty warm for mid-June. Usually that's July, August weather. Yep. So a lot of the country is experiencing higher temperatures than they're used to.
Yes. Now, it's interesting you mentioned temperatures. So the way to really monitor the stress on the body is to get something called a wet globe. I think it's called a wet globe temperature or something like that. But the important thing is that it's not just the temperature that's showing up on the thermometer, the humidity, right? The exposure. There's a lot of factors that create. I mean, if you're in the shade in the heat, it's a whole lot different than being exposed.
But it's a dry heat.
Well, it is better if it's a dry heat.
It is, yes.
But when you have a thermometer, a glass bulb thermometer and a wet towel out where you are maybe having an athletic activity, that temperature that will register on that thermometer is really the best measurement for the effect that the temperature of the environment is going to have on your body. Right. And that's actually what schools use to determine whether or not they're going to cancel football practice or whatever.
Oh, really?
Yeah, it's interesting. That's what we monitor here where I'm a medical director. We look at that temperature rating is really how we make decisions on whether or not we cancel things.
Now, as a physician, what would you say, what's your cutoff for a patient body temperature to be considered hyperthermic?
Oh, good question. So really it's a clinical diagnosis. You might be 102.
But still be altered.
Yeah. If you're altered, that takes you over from heat exhaustion to heat stroke. And that's where, the risk, of course, is, damaging brain cells. And
if they have comorbidities, different things, they don't regulate, whatever the case may be. Somebody could have a lower temperature and have a worse problem than you and I could thermoregulate better, and we could be 101 and not be as dangerous or in a dangerous spot as them.
Well, you said the word right there, thermoregulation. That's really what's going on in our bodies to try to regulate our temperature. We are homeotherms. Yes. We have a temperature range that we want to stay within because that's where our body's chemical reactions occur best, and that's where the proteins in our body stay together in that temperature range.
That's right.
And you get outside of that temperature range, you can have some problems, whether it's the enzyme's not working because it's too cold, or the enzyme's falling apart because it's too hot.
Yeah.
And so that thermoregulation is key, what you said. So let's talk about some things that the body will do to compensate when we get hot. So you and I, we're doing the podcast outside. It's 100 degrees, direct heat, and here in Texas. What are we going to see in our bodies right away?
Well, right away, you're going to start sweating.
Correct.
Right? You're going to start sweating, and that's a way that your body's trying to cool off.
That's right.
You're getting water dripping down your skin. Hopefully, it's a little bit of a breeze, and that's going to help cool your temperature down, your body temperature down.
And then there's also the capillaries and the surface in our skin. We're gonna vasodilate. We're gonna constrict. We're gonna try to maintain a temperature. Yeah. We have this thing called the brain.
We do.
We do. Isn't that crazy?
It's an amazing organ.
But this is actually really important. is to know that we're at risk, and we know that we need to go shoot the podcast in the shade over there,
it's
or
getting too
go
hot.
inside. Right.
Yeah, it's like being a firefighter inside of a house fire.
Yeah.
The old school guys, I never experienced this, but the old school guys before they had hoods,
Yeah.
their ears, they're like, oh, this is getting too hot, my ears are starting to burn. That was their temperature
Interesting.
regulator saying, hey, it's getting too hot, we need to back out.
That's
Same
interesting.
thing, you feel it, you're sitting outside, you're like, oh man, I'm getting a little uncomfortable.
Yep.
We need to get in the shade, we need to get inside, whatever.
And then you start to get dehydrated. Our body's going to get that thirst
Right.
impulse, and so we're going to want to get some water.
Right.
So these are all parts of the mechanisms of thermoregulation for when we get too hot. Here's a cool story, Matt. So I was reading a book recently, written by a hand surgeon, I think out of New York, but it was called, I think the name of the book was The Physiology of the Extremes, and there was this one chapter on heat emergencies. It was really interesting.
Really? From a
And
hand surgeon?
Yeah, and they were
In New York.
Yeah, I know. Well, they were covering. Well, it gets weirder. So they were actually covering, the ultra marathon runners that run in the Sahara Desert for like 100
Oh
miles.
yeah, the Badlands 100 or whatever.
That's
it is.
right. Well, these folks are training in that high temperature, so they're actually running at temperatures that would really maybe scare the normal person.
Yes.
104, 105
Doesn't scare
degrees.
David Goggins.
No, it sure doesn't.
He lives to run at 104 degrees.
Does he do this kind of thing?
Oh yeah, that's
Oh, I
what
didn't understand. I
he
didn't know
did. That was one of his famous stories. Was after his SEAL career and all that stuff. And I believe the race is the Badland 100. And it was
Sounds
considered
right.
the hardest. I want to say, if I'm not incorrect, I think it goes through Death Valley. Maybe it goes through a very extreme hot place,
Yeah.
and it's a 100-mile race. And he called the race organizer and said, like, hey, I want to test myself. I want to do this. And the guy's like, hang on, bro. Like, you don't just sign up for this race. You have to prove that you can run 100 miles within 24 hours, which took David Goggins to, he had to run a sanctioned race and have a time. And then that's a whole other story. But yes, he's known for running in those crazy conditions.
Well, what they found with these ultra marathoners, and maybe this gentleman you speak of has this too, but our body actually generates these things called chaperone proteins.
Yeah, we've talked about this before. Yeah.
And what they do is they create an insulation almost around some of these proteins that would normally fall apart at a certain temperature. The chaperone proteins will protect it and hold it together, so we can actually function at higher temperatures.
Yeah.
And which is great in the body because a lot of things change with oxygen dissociation. A lot of things change with metabolic rate when we get the temperature up. So actually these ultra marathoners are actually functioning at a very high level at, technically a fever or hyperthermia. So your question earlier was, what temperature makes me concerned? Well, it's
subjective.
It is subjective.
Yeah.
If I went out and ran in Death Valley after
We would die.
1 mile,
We would both be dead.
what am I doing? My cerebral cortex, danger, right? Get into the shade.
Your chaperone proteins are,
Yes.
we're leaving the dance, bro. You're on
Right.
your own. Yeah.
So what happens sometimes, unfortunately, is that we do get into trouble for various reasons.
That's right.
Quick story, I was out dirt biking with a friend of mine out in California somewhere, and we were out in the hills and we got lost. And one of the bikes broke down.
Oh, of course.
And so I was actually, for a while there, I was kind of scared.
Sure.
And we didn't have our shirts on. I mean, we were idiots.
No water.
Didn't have any water with us, and we were very concerned. And I started to get to that point. It's like, I am really hot, and I am really thirsty, and I have no idea where I am. I was really getting a little scared.
Yeah.
But I remember that clearly, though, as being a time when I started to push it to the limit. I knew that I was in a bad spot. Well, sometimes our patients get into bad spots, whether it's a football player at two-a-days who's being a tough guy that doesn't want to take water, or maybe hopefully not the coach. Hopefully there's a good system for getting water, but sometimes we're called to the scene with somebody with a heat emergency. So I think it's really important we talk about this, especially being summer.
Is another big susceptible.
Yeah, that's right.
I look around and I see these guys. Just the other day, I don't remember, I saw these guys on a roof, and I'm thinking, oh my goodness.
Oh,
I mean, it was like, it was over with the heat index and everything. It was well over 100 degrees. And I thought, oh my gosh, that looks so hot, which is one thing. A lot of these guys, you'll see them, and they're wearing, like, you and I'd probably be out there shirtless and shorts,
Right.
No. the people that come from hotter climates, they're smart, right? And they typically will wear long sleeve shirts. A lot of them will have hoods on, and they'll be wearing long pants and everything because that sweat then soaks that shirt and actually helps keep them cooler.
That's right. In fact, I was curious how much water I lost mowing the lawn. I've got about an acre.
Of course, you would do that.
And
did you measure your sweat?
Well, what I did, I want to be scientific because I was at the time, I was working with a friend to lose some weight, and we were weighing each other. Well, he didn't weigh me. We were weighing each other. I was losing weight, and I noticed that I had a really low weight after I had mowed the lawn. I was like, I wish I would have mowed before just to see how much I lost. Yeah. Because when I mow the lawn, like you were talking about, I mow in a like a light color sweatshirt, sweatpants, sun hat. I mean, everything is covered and to protect my skin, but also like you said, when you sweat, that wet cotton can really keep you cool.
That's right.
Well, anyway, so I lost 7 pounds of water. Now it takes you about 3 hours, 100-degree heat with the humidity,
7 pounds.
Wearing sweatpants,
were you drinking
sweatshirts.
any water as you were doing?
No,
so
nothing.
You were super dehydrated.
Nothing, and I was tired.
Pee was yellow.
I just wanted to see what. I probably went into rhabdomyolysis.
Your wife's looking at you going, "What an idiot."
But I weighed myself. 7 pounds of water.
Wow.
Boy, I drank a ton of water afterwards.
Did you feel crummy at all?
I felt very tired. Yeah. And but I mean, if I really felt bad, I would have done something. But I didn't. I'm a bigger guy too. Yeah. So when you weigh 250 pounds, you can, what's 7 pounds? Right. 60% of your body's water.
7 pounds on you is a little different than 7 pounds on me.
Right. Well, that's part of the reason why if a baby isn't left in a car too long, they can't thermoregulate like we can. Their body surface area and mass and volume is so wonky, whereas a bigger guy like me, I can handle that, right? But a little kid in a hot car, oh my gosh, get up over 140 degrees in there, they can die pretty quick, and that's why it's so important to taking care of our kiddos in the heat. The other population that would be worth talking about too is the geriatric population. Medications
it's always the young and the old with everything.
It is. Unfortunately, us middle people, we're stupid sometimes.
Yes.
And we go dirt biking
especially
without
us
water.
middle-aged men. We still think we're 20. 7 pounds of clothes on, and So let's go ahead.
Oh no, I was just going to say that
geriatrics.
We get into bad situations sometimes, whether we have risk factors of our age, risk factors of comorbidities, risk factors of exposure in our jobs, risk factors of athletic activities or leisure activities like hiking. And you get into trouble, right? So, for whatever the reason, you're the responder. 911 is called. You're on scene. And you got to take care of the patient.
Before we do that, there's one more patient population that is probably watching this podcast right now.
Oh, gosh.
Firefighters.
Yeah.
Firefighters, especially us here in Texas. Yep. So I don't know, like up north, what they do, but I know here in Texas, most, departments are very cognizant when the temperatures get super high. You get a structure fire. Yep. I'm putting on 60 whatever pounds of gear that does not breathe.
Really that much?
Oh yeah, it's. I mean, depending on your.
I didn't know actually how heavy it was.
Well, so again, everything's relative, right? Yep. You're a bigger guy.
Yep.
Your gear is going to weigh a little bit more than mine is, right? Because I have less material, right? But yeah, I mean, 50 to 80 pounds of gear, and that's just like the gear. Well,
your oxygen tank's going to. There's certain things
O2 tanks, whether if you're using 30-minute or 45-minute bottles, that makes a difference. 25-ish pounds is probably what your oxygen bottle or your SCBA weighs. And then your gear. But the big thing is that we're talking about is that gear does not breathe. It's 3 layers thick, and it just holds all that heat inside because it's trying to protect you, right? And you're wearing hood, so how do you get rid of most of your heat, right? And so now you got a hood on with a helmet on, right? You're wearing all this gear, weight, and now you're doing a full-on CrossFit workout. You're pulling hose, you're doing all. So you are losing a tremendous amount of sweat, fluids. That's why it's so important for our firefighters. Make sure you are hydrating before your shift. Do not come into your shift dehydrated, because you're setting yourself up for a real bad thing. If you're running command, if you're running a fire, you got to be mindful of that. Maybe in February they could go through 2 bottles before they have to come out and go to rehab. Not in this kind of heat. 1 bottle, 15, 20 minutes, they need to go to rehab. They need to get rehydrated before they can think about getting back, or else you're setting yourself. They just had, where was it? New York. New York, I just saw the other day, the New York City Fire Department experiencing higher temps than normal, and several of the FDNY guys, these guys are very experienced. They wear their gear all the time. They fight a lot of fire, right?
Super fit too, probably.
And probably super fit, but this is what they do. They're acclimated and operating in these environments, but they're not acclimated at doing it in these air temperatures, and several of them had to be transported to the hospital. They were hypothermic. They were having... Hyperthermic, yeah. They were having... I might have. But they were having... whether it was heat stroke or heat exhaustion, but they were transported due to the heat. So firefighters, another huge population that we typically don't think of ourselves as the patients, and we need to keep that in mind.
So when the environment or the situation causes us to overrun our body's ability to thermoregulate, that's when we get into heat exhaustion. Normally we're able to compensate with sweating and hopefully getting a cold glass of water, moving to the
AC,
shade. Exactly.
Whatever.
We can thermoregulate, but sometimes we can't do that. Like a football player in full gear, helmet, exerting themselves, firefighter, gear, all this stuff. Sometimes you just can't get to the place you need to get to cool down. Well, what can happen, what we run the risk of, is not being able to thermoregulate. So normally when we're compensating and keeping our temperature down in that safe range, when things don't go well and we run out of water, dehydrated, then now temperature's starting to creep up and we can't thermoregulate. It's like you're running on a treadmill that's going too fast in the wrong direction.
That's right.
And so eventually you'll get to a point where you get to heat stroke. And the sign of heat stroke is pretty simple. It's just like with sepsis, it's organ dysfunction. And the first organ to go,
the most sensitive one.
Right. This is the one that's most sensitive to these things is the brain. That's right. And the brain will start to create an ultramental status. That's right. And that's the sign of heat stroke.
And a lot of people talk about heat stroke. Oh, you'll stop sweating. Right? That's kind of hard to judge sometimes, right? Because maybe they're still wet and you're thinking they're still sweating, where actually they've stopped sweating. That's just sweat from 10 minutes ago, right? You feel their clothes and you're like, oh, their clothes are wet. They're still sweating. But the altered mental status is a much easier thing to identify. And obviously we're identifying that is due to the heat, right? We're checking blood sugars. We're checking other things to make sure, okay, is this heat related? We're getting their temperature, right? But altered mental status, when you've got that, what you believe is a hyperthermic patient, and they are altered, that is a true medical emergency, life-threatening medical emergency.
So why don't we, I got a case for you, Matt. Okay. So I was mountain biking not too long ago here in the area, and it was hot, and I don't like to actually mountain bike in the heat, but boy, do I prehydrate, and I bring water with me, and what a great workout, right? Well, I came upon somebody who was sitting on the ground with their bike on the ground, and they didn't look very good. Sure enough, heat exhaustion, maybe even heat stroke. What's the first thing you would do if you came on scene to somebody like this that exerted themselves too much? I'll tell you what I did, but what would you do?
Well, if possible, the first thing I would do is try to get them out of that hot environment.
Exactly. That's right. That's
obviously, if they're out on a trail, or you don't have an ambulance, or you're on your bike, but get them into the shade at least, right? Get a cool towel on them.
They were sitting in the open, the heat, and I had to direct them off to the side. They were scared of snakes and all this stuff, but we got in the shade. In the
What's the more immediate problem?
And she was not in good shape. Now, what I also did is I took my water bottle, I poured it on her.
All over
poured it on her.
Get her wet.
Got her wet, cool her down a little bit. She drank some too. She didn't have water.
But cooling that skin down, that temperature down is crucial. I think it's important to note that, we talk about a lot of times with hypothermia, they're too cold. Metabolic rate has slowed. They've almost gone into like a hibernation state. Their brain, their metabolic demand has slowed considerably, right? With hyperthermia, it's the exact opposite. We can we should slowly rewarm our hypothermic patients. With hyperthermic patients, their metabolic rate has dramatically increased. We have got to cool them down very fast because literally their brain is cooking. And we've got to bring their temperature down quickly, efficiently.
Good. So we talked about some of the assessment thing. We assessed our mountain bikers. And we talked about treatment. Let's talk a little bit more about treatment. So
Get them in the cool environment.
Cool environment. That's
Number one, easy thing.
Easy. That's like the first thing you got to do.
Yep.
And then once you're in the cooler environment and you've got this hyperthermic patient, we could. I mean, there's been a lot of talk about ice packs in the axilla or whatever. That's fine, but it really doesn't do much.
Yeah. Right.
Even IV fluids.
Yep.
I mean, that can help, but it's not. It's good for the dehydrated patient. Obviously, we should do that.
Yeah.
But if you're trying to get the temperature down, one of the coolest things that we could do, no pun intended, actually pun intended, is evaporative cooling.
Yeah.
Like we pour the water on that patient, right? And
ice
the gentle
baths.
breeze and the shade, boy, that's going to cool you down pretty quick.
Yeah.
Ice bath. If you have an ice bath in the back of your ambulance, please tell me what agency you work
Well,
for.
but be creative, right? So football players, you talked about that. Very common issue here in Texas in the summertime, right? They will probably at that high school
have an ice bath
facility have ice baths. So ask the coach, hey, if you got a patient that you think is severely hyperthermic in heat stroke, do you guys have an ice bath? Get them into that ice bath is more important than throwing them in the back of your ambulance.
That's correct.
I know of one case that was here in Texas. Another way to think creative, thinking outside the box. We're really good at that as first responders. They responded to, I believe it was a Costco for a medical emergency, showed up as a homeless person in true heat stroke, altered mental status, really messed up. These firefighters were super creative, and they thought, we've got to do something right now. I want to say his body temperature is like a 107.
Yeah.
I mean, he was cooking.
Oh yeah.
And they were like, we don't have time.
I've seen 109. That's the highest I've ever seen.
Yeah,
But, go ahead.
107's bad.
That's bad.
So,
Really?
what did they do? They went to their engine. They got a tarp. Those big giant Costco shopping carts.
Yeah.
They went inside. They put the tarp inside of the big Costco shopping cart. Asked Costco, said, we need ice. And they dumped a bunch of ice and got it filled up with water and put the patient into the shopping cart filled with ice water and cooled them off that way. So think outside the box, right? Because that's what they need. They don't need to be transported right now to the hospital. You got to get them cooled off.
And that's something else that we did in the agency where I'm a medical director. We worked with the athletic trainers of the local high schools where we said, hey, you know what? If you do have a heat emergency, it's okay to leave that, to stay on scene to get to that ice tank.
Yes.
And work with the athletic training department to get that patient the care that they need.
Super, super important to keep that in mind. So many times people are in such a rush to run to the back of the ambulance like there's some kind of magic that happens back there.
No.
And sometimes in a trauma or something like that, you do need to do that.
Yep.
But that's not the answer for every patient. No. And these hyperthermic patients is one of those patients where you could be much better off going to an ice bath or creating an ice bath where you're at and cooling that patient off right there.
Some drug overdoses can cause hyperthermia too.
Malignant hypothermia in a OR setting is a huge risk. Now they have medications that they give for that, but another
even
risk factor.
endocrine emergencies, thyroid storm can cause hyperthermia.
Right. Didn't you have a bad thyroid storm patient?
In fact, we even put at the time it was a newer device where we put in a central line up the inferior vena cava, which was like this water bladder that would circulate cold water internally inside of the IVC, which was pretty cool. It was funny. Punny. It really was cool though, and I'm not sure on the evidence on how effective that is,
right? Especially
especially compared to the evaporative cooling or the ice tanks. I mean, that's pretty impressive.
We have these chairs with my department. So, we get a structure fire. We're very lucky. We have citizens that come out with a rehab truck. And we have these actually a long time ago when I was on days. I bought these evaporative cooling fans. You'd fill up this big tub with water, and then it was plumbed in, and it would mist you. It was these misters fans. And then we had these chairs that we would sit in that the arms were open. You would actually sit your arms down into cool water. And we had wet rags and all these things. We would do rehab in the shade. It was very strategic how we would do things in the summertime to make sure we were staying cool.
Right. That's really cool. Well, exerting yourself is the part of, I think, what creates the problem.
Yes.
Because when you're exerting yourself in a hot environment, it's just a recipe for disaster if you're not hydrated or you don't have access to water or don't have access to an environment where you can cool down.
Yep. That's right.
That's where people get into trouble. So you've got your patient. We've poured the water on them. We're in the shade. We've removed them from the heat, obviously, but we're still a couple miles away from where the parking lot. I mean, it's going to be. It's an access problem that we had. Fortunately, she didn't need medical services.
Bad yet. Yeah.
After a half hour or so sitting with her, she started to feel a whole lot better.
That's good.
And her and her family reunited, and they walked back together.
Oh, she was walking, not biking?
No, her family lost her. So she was by herself, sitting on the ground next to her bike, not sure what to do.
Yeah, right.
Shouldn't have been out there.
Right.
And when I had her in the shade, the family came out.
Oh, gotcha.
I don't know where they came from.
Yeah.
But then we were able to get her back to her car. But the treatment, though, sometimes these patients with heat emergencies really require ICU level care. Mm-hmm. And so you get a heat emergency, heat stroke. You don't. I mean, take them to follow your protocols. But one of the big problems is something called rhabdomyolysis, where your body starts breaking down the muscles, and then your kidneys get all gummed up with this, and so
that coke-like urine.
That's right. That's right.
Bad stuff.
And you can really go into renal failure here. So it's a serious condition. Like when I mow the lawn, right? I mean, I'm kind of putting my body at risk for getting to that point.
We've had multiple people, well, not multiple, but we have had doing PATs. A lot of fire departments are hiring, right? And they come out and do their PATs. Well, what are these young, guys that I gotta go as hard as I can, and we've had before where patients or guys have collapsed, and we've had to transport guys to the hospital because they were going all out wearing gear. They're not acclimated to that, right? And they're not they're working out in the gym, in the air conditioning. They're not
weight room strong.
Exactly. And so they're not acclimated to that kind of stuff. And they collapse, they pass out, they start, whatever the case may be, and we got to take them to the hospital. And a couple of them have ended up in the ICU with rhabdo.
Yeah,
definitely
that's a serious issue.
Yeah,
and rhabdo doesn't just happen to the heat, right?
Yeah.
Just on a side note, this really isn't specifically related to hyperthermia, but the geriatric patient population, if they've fallen, they can't get up, and they're in the same spot for a couple days, just that immobilization can cause rhabdo too. So it's something to think.
Lots of things can cause.
Yeah, that's right. Lots of things, but we're not talking about that. But thermoregulation, heat emergencies right now, big issue. You're probably going to see something this summer.
Yeah, the key is get them out of that hot environment. That's the most important thing. Altered mental status. If they are altered, you might want to think about airway intervention, but get them cooled off. That's the number one thing. Evaporative cooling, get them wet. If all you have is the back of your ambulance, crank that AC on. Get their clothes off, douse them with water, get them cool.
You know what our guys do in our agency is with our protocols, what we've done is we grab a fan off the engine. Is it standard?
The PPV fan?
I don't know what it's called.
If it's the ventilation fan, then
So that's
the big one that blows really fast.
Yep.
Yeah, that's a PPV fan.
Spray down the patient, get them wet, and turn that fan on.
Yeah.
And it's a real effective way to cool them.
Another thing to think about, though, is you don't want to get them to the stage of shivering. You don't want to get them so cold that they actually start shivering, because that's going to then increase their temperature.
I'm glad you mentioned that. That's so true. Yeah, that's.
You want to do it aggressively but cautiously.
That's right. Yeah. That's right. Man, great. That's great. Any other?
No,
hurdles?
Important topic. Just thought it'd be a good thing to talk about with all the heat wave going on in the country right now. Like I say, a lot of places that don't experience heat like we're used to, and just like us, we're not used to the snow and the ice and all those things. We don't have the infrastructure for it. We're not used to it. They're dealing with that, especially up north. And so these are good reminders for them.
And one thing I think it's worth mentioning is we've talked about identification, the thermoregulation, the management of this, but prevention's huge.
Yes.
Staying hydrated. We've talked about that already. Wearing
Taking
clothes
breaks.
that you are appropriate, right, for the environment. Sunscreen too. I mean, that's another heat emergency, I guess, of sorts. It's just like frostbite's kind of. It's not hypothermia, but you can damage your skin. But I think prevention's key. Stay in a cool place. Stay out. Don't exert yourself out in heat exposure.
That's right. And if you're a firefighter and you're on a fire ground, it's hot, and you feel off, tell your command, like, hey, I need to come out, right? Because we don't want people getting sick and injured for no reason.
Can't help anybody if you're sick.
Exactly. There's no reason to push yourself and get into rhabdo or some serious medical condition. You might not be able to come back to work. So it's okay to say, hey, I need to take a break, go sit down, get some water.
It's been a good topic. Good topic.
See you on the next one.
Be safe out there.
Thank you for listening to EMS, the Erik and Matt Show.